Hey everybody, welcome to another training that we are doing at FACS, and this one being on trauma screening of our clients. This particular training is coming out of past trainings that have been done at FACS in being able to identify trauma. And one of the things we're wanting to do as part of an agency is get better at the identification and treatment of clients with traumatic backgrounds. There's many reasons why this is important. Some of this has to do with being able to accurately identify that a client has trauma. The state loves when we use screening instruments as part of any diagnostic assessment, helping clients obviously recognize trauma, as well as improving outcomes and treatment for the clients we serve. There are primarily three, you could say four, trauma screening tools that we're going to be using with clients on a regular basis. First one is called the Child Stress Disorder Checklist form. There's the short form, which is done at the initial screen, and a longer 30-question form that is done at follow-up. These two instruments are for parents to fill out. The screenings used for children include the Traumatic Stress Screen for Children and Adolescents, and then the follow-up after the initial screen would include the Child PTSD Symptom Scale, or the CPSS. So here's how we're going to work this. At the initial screen, so this is at intake, within the clinic, obviously clients would be giving these to be filled out either before the session or as part of their initial session. For home-based staff or school-linked or some of the early childhood programs, parents will be given this information at the initial intake meeting with them to fill out regarding their children. The parents fill out the 4-question CSDC short form, and this is for any age kid. Children are going to be filling out the 5-question TSSCA, and these are children ages 8 to 17. Now, you have to use some clinical judgment here about whether the age of the child may affect whether they're able to fill out these forms by themselves or may have to have the form presented to them orally to fill it out. You'll make that call, but just be aware that that could be a consideration when you're doing this, particularly with younger children. So, here's how you know if within these screening tools that a screen is positive. Within the CSDC, the short form, scores of 1 or higher are positive and should trigger the 30-question follow-up for a parent. It is likely preferable to have the parent fill that out the same day they're filling out the short form. That's not required, but it'd be good to get that information in during that same visit so that you're able to see what the parent is telling you regarding the effects of trauma on their child. Now on the TSSCA, a score of 4 or higher is going to trigger the follow-up CPSS. So just know that when you're looking at cutoffs for those instruments. And then the follow-up, parents are filling out the 30-question CSDC after that initial screen and every 3 months after. You may want to think about this in terms of doing it at the same time you're doing your treatment plan review with the family. It's a good reminder. It's something that you'll be doing anyways with the family. And we will be updating the trigger list on the workflow to help remind you of also doing these screens afterwards. And kids ages 8 and up are going to be doing the CPSS. Now, the form that staff will be using includes, the first time you're filling it out, includes information about possible trauma the child has experienced, and then there's the actual CPSS form. After they fill out that for the first time, they only need to fill out the CPSS every 3 months. It'll make sense when you see the form itself, but just know that there are 2 parts if a child initially fills out the CPSS symptom scale. So here's some cutoffs to be aware of. With the CPSS, again, this is what the child fills out, scores greater than 12 are likely indicating clinically significant symptoms that the kid is experiencing. Nice thing about the CPSS, it can also be used as a diagnostic tool. There will be a cheat sheet that will be attached to the information for the CPSS that you can access through the VPN that will help you understand better how to present this information, as well as understanding diagnostically what this is telling you. Bottom line is what you're being told through the CPSS is different PTSD symptoms and the severity of those symptoms based on what the child fills out on that form. On the CSDC, this is measuring the parental perception of PTSD symptoms for their child. So over time, you should see a reduction in this overall score to indicate positive progression in treatment. So here's some things to keep in mind. It's really, really, really helpful to review these results with families. People who come in want to know what they're experiencing and make sense of it. So just like you would be going to a doctor and the doctor would give you their assessment based on the symptoms you're experiencing, the clinician should be reviewing the screening tools as well as giving them some indication about how this is affecting them and obviously the severity of it. The nice thing about these is after they're filled out, you can begin targeting these particular symptoms in your treatment plan. And again, as we mentioned before, that we're going to be tracking these forms every 3 months, which will allow us to track change over time and actually give us really good data about whether we are being effective in our overall treatment for kids with trauma. Thanks. I hope that is helpful to you. If you have any further questions, please ask your coordinator and refer to the screening tools that will be located on the VPN.